I think at the beginning of the pandemic, we just started learning that the COVID-19 impact was much concentrated in like an older population, above 60, 70 years old. And that was where we were seeing the majority of complications, hospital admissions, and mortality. Later, we learned that young people, in their 20s, their 30s, their 40s, they also get sick with COVID. And we have seen here in the hospital cases of severe hospitalizations in young people. I think now the trends are probably caused by a little bit of conformity, a little bit of relaxation of the rules of social distancing, the reluctance to use face masks, with the wrong perception that they are okay getting the coronavirus, the COVID-19. However, we have seen cases, again, I repeat, that they can get severe infection, and then most importantly, they can pass the infection to their families or to the vulnerable adults that live with them. So a huge proportion of the cases that we have seen in the last couple of weeks is explained by that uptrend trend in the young population. Regarding work, I think if the individual take the precautions and there is adjustments and policies in the workplace about how to maintain social distancing, how to use consistently the face mask, I think it's possible to return to work. Most businesses, most corporations, most of the construction work industry has adopted precautions for the COVID-19, and I think it's just in the hands of those individuals to keep adherence to those precautions. In terms of going back to mass gatherings, like the ones we do, for example, in churches or some other sports events, I think at this point, with the severe dissemination of the virus and ongoing transmission in the community, it's probably not a good idea to engage in those massive gatherings, especially in closed environments where we know that the virus is circulating for longer periods of time. In terms of a school, I think it will depend what's going to happen at that time on the level of community spreading. I think if the community spreading of COVID-19 at that time is really high, as we are seeing right now, it's going to be more challenge for our kids to keep them safe from acquiring COVID in the school. So a lot of those decisions, I think, is going to be, and they're going to have to be carefully evaluated, depending on the statistics or what is going on the community at that time. That's why it's important to change the course. And the way to change the course is right now engaging with the social distancing precautions, engaging with the universal use of the face mask, and reverting the rates of COVID spreading that are ongoing right now, and they're going up and they keep going up for the last couple of weeks. So in general, the kids are more older than 2 years old, the face masks are safe. Less than 2 years old, they don't have enough awareness to wear the mask, and for that reason it's discouraged. But it's a process to get the kids to engage and wear the face mask. I think the first step is explain them in detail in a very simple way why we're doing this. We're doing this to protect our families, to protect other members of the community, and they need to be explained the reason for doing that. But the parents probably need to be aware of a couple scenarios. If the kid feels very uncomfortable, it's probably not a good idea to do it. If you see that the kid is reaching the face to touch the nose, their face, or the mouth, and he's really uncomfortable with the face mask, it's not probably a good idea, because he had more risk of transmission of the virus just doing that. And I think it has to involve a process or get the kids engaged on that concept, or getting the face mask, make sure they don't feel ashamed, they may feel they are conscious why we're doing that. That is in terms of protecting everybody around. And also we can make it more enjoyable, you know, doing some adjustment to the face mask, printing some themes, etc. So we can make them a little bit more natural. But I think they deserve an explanation. They deserve a little bit of process of coaching and education while we're doing that. And so one thing is important is at home, the kids don't need to wear the face mask. And if they are going to engage in activities, let's say like in the park or something like that, and they're not going to have interaction with other people except the family, I think they are not required to use face masks. Now, if you predict you're going to take them to a place that they're going to interact with other people, they're going to be in close contact, I think it's a good idea to use face masks. If you're taking the kid to the pharmacy, to the grocery store, to visit the doctor in the hospital, I think for sure it's a good idea to wear face masks for the kids. So we have to entail individualization, education, coaching, patience, just to get the kids involved in that too.